Hello everyone. I am Dr. Berk. In the Blackboard series, we continue with penile prosthesis. Our video is a bit long, but those who want to have an idea about the prosthesis do not need to watch another video after watching this video. I'll also show you a couple of examples. At the same time, we have a table, which is very important. It's not a comparison or a chart that you can find both in doctors' interviews and anywhere. Now I've added two numbers on the penile prosthesis, 96 to 99, 96 to 99, which is the success rate of the prosthesis, and this is the happiness rate. The happiness rate is close to 100% in almost all successful prostheses. Of course, since there is no such thing as 100% in medicine, we usually give 99%. Who are we making the prosthesis for now? This is important. The first is for those who do not benefit from treatment. In other words, you have not received drug treatment, needle therapy, Doppler and venous leakage, etc. When there is no response to any treatment, we apply a prosthesis, which is the last step treatment in erectile dysfunction. There are also those who benefit from the treatment but do not want to do the treatment or cannot do it. For example, those who take medication against the drug and have side effects, for example, if they have a fear of needles, if they have a phobia of needles, if they cannot do themselves, if their dexterity is not very good, then we recommend penile prosthesis in such patients. Unresolved premature ejaculation. These two are not book information, these are book knowledge, theoretically exist, this practical knowledge. The patient group I deal with the most is premature ejaculation. Therefore, sometimes premature ejaculations that we cannot solve come to the sex therapist, we give behavioral therapy, we give medication. It is a subconscious reason, and it is not always possible to reveal the subconscious causes. In such cases, we recommend prostheses for unresolved premature ejaculation, especially if they are young and married, so that the marriage bond is not disrupted. Can a prosthesis be made at the request of the patient? Yes, it would. The book is not based on knowledge, but it can also be prosthetic at the request of the patient. The person does not want to use medication. The drug has no side effects. He could give a needle, but he doesn't want to. He has more than one partner. He does not want to receive any treatment or medication all the time. This can be an example of patient request. Now we have these four important pieces of information. This is very important. I say this to every patient. Now, what you call a prosthesis is not visible from the outside. It's not like a hand-foot prosthesis. That's what people think. It will be obvious from the outside that I will have something like a hand-foot prosthesis fitted. My teacher said, "Son, tell all prosthetic patients what I am going to say so that they will not get out of their minds." Of course, I can't say this directly here because of the video, but I can polite him like this. He said that if you have a prosthesis, a pros of 40 years will not understand that you have a prosthesis. It's that clear. Or another example. Someone is walking towards you from the opposite direction, coming from the opposite direction. You wouldn't know he had a hip replacement, a stent in his heart, or a prosthesis somewhere in the body. That's what a penile prosthesis looks like. It has no effect on voiding function and ejaculation function. It doesn't change. Because our topic is not about the urinary tract, pleasure is the same or increases. It's usually increasing. Now some people say, well, we put prosthetics, it's an artificial thing. Is there any pleasure in something artificial? So here's how I put it. Consider, for example, a pumpkin. You start hollowing out the pumpkin. The outside of the pumpkin is the same. It is not obvious from the outside what it is. You put rice in it. It's more enjoyable. The more it tastes, the better. So is this. Patients who have implants with prostheses already have erectile dysfunction. The man already has problems with pleasure or has excessive premature ejaculation. When you put a prosthesis, since all of these pass, the pleasure increases, and the pleasure of the other party increases. Because this 96% and 99% ratio is not only the happiness of the people themselves, but also the happiness of their spouses. Therefore, there is an increase in mutual pleasure. Now in the assortment of prosthetics there are 1-piece, 2-piece, 3-piece. I'm not going to talk much about 1 and 2-piece. I don't use 2-piece at the moment. In other words, there will be very good technological developments in the coming times. We can use it, but we don't use it right now. Usually 1-piece or 3-piece. The 3-part ones are also split into transverse and transverse prostheses. These have brands. There are already 3 brands in Turkey. There is a brand called AMS, Calipers and Rigicon. All of them are on the American side, that is, the patent is in America. Technically, they are no different from each other. Now, sir, when you say what are you using right now, I am using Rigicon. Why? The reason I use them is that Rigicon gives a lifetime warranty on the prosthesis. If there is a mechanical defect in the prosthesis, especially in the 3-piece prosthesis, they can change it. So just because I'm using it doesn't necessarily mean I'm using it tomorrow. It does not mean that I will only perform surgery with this prosthesis company. In other words, the patient necessarily says I want AMS. We can also do AMS. There is no difference. So for me, just because I use it today doesn't mean I won't use someone else tomorrow. Some doctor friends have provided statements here for our patients to consider. Not the right statements. It is not the right approach to say that this is the Mercedes and this is the BMW. There is not much technical difference between prostheses at the moment. Everyone has a prosthetic company or prosthesis that they are used to. It goes on and on. But it's not the right approach to say I'm just going to do this, it's the best. This is important. Now, let's interrupt our video here. I'm going to show you the 1-piece prosthesis, I'm going to show you the 3-piece prosthesis, I'm going to explain the working logic, I'm going to tell you what it means, and then we're going to go back and continue with this table below, which I think is very important. The prosthesis you see in my hand is a 1-piece prosthesis. We put 2 of these. We put it as one to the right, one to the left. These prostheses can usually move down, up, right, left after passing 10 to 15 degrees into the penis, but usually the prosthesis stands upright. During intercourse, we can correct what we do minimally and enter into intercourse. Of course, these prostheses are placed specifically for the patient. In other words, the length and thickness of the patient is determined during the surgery and it is placed in that way. And this is our 3-piece prosthesis. It has right and left parts. We have a reservoir just above it. We put this reservoir in the abdomen. We put our pump just below between the eggs, between both plants. By pressing in this way, this pump takes the water from the reservoir and transfers it to the prosthesis. Of course, the amount of compression varies from person to person. You know, depending on the size of the penis, it is necessary to press 7 to 8 times in large penises, 5 to 6 times in smaller penises. The number of presses doesn't matter much. But in this way, our prostheses swell. This is the prosthesis that we see on the left, which expands transversely, and the other one that expands transversely and longitudinally. As you can see here. Therefore, what we said that there is no loss of height in the prosthesis that expands transversely. When we're done, we have a little button right under this pump. We press this button, and after pressing it, we put a little pressure on our penis to make it descend quickly. In this way, the prosthesis descends and returns to its normal position in this way. Yes, after getting to know the prostheses, we continue with the table. This table is very important. It's not a picture you can find everywhere, but for the most part, you'll never be told anything like that. Frankly, I don't sit down with my patients and tell them from top to bottom. I explain in a little more detail, but not this much. Now here we have 1-piece, 2-piece, 3-piece transverse and longitudinal. That's how this column is. This column also contains information. Now, when we look at it in terms of sexual satisfaction, we said that it is the same for all of them. There is already 96 to 99% satisfaction for both the person himself and the spouse. Therefore, this is the same. There is no difference between them. Height loss is one of the most worrying issues. Yes, there's a loss of height, especially in 1-piece, 2-piece and 3-piece transverse growing prostheses. How much does this happen? There is no loss of height of 5 centimeters. There is no loss of length of 2 to 3 millimeters. An average of 5 millimeters can be 1 centimeter, and in some patients it can be 1.5 centimeters. How important is this? It's a question, because there is already erectile dysfunction in the patients for whom we have made the prosthesis. Patients are already unable to have intercourse. So there is an option here. In other words, you will not be able to have intercourse, or it will be 1 centimeter short. Or if you say you don't want any height loss, then a 3-piece transverse and longitudinal growing prosthesis can be inserted. There is some loss of height at the beginning, but then as the use of the prosthesis progresses, the flexibility of the tissues increases, so the prosthesis can extend towards the length. Mechanical failure is almost the same in these 3 companies. There is no mechanical failure in the 1-piece prosthesis. This happens in 2 and 3 parts as well. Here, they predict a mechanical failure of less than 5% within 5 years. All companies are the same. Ease of use. In terms of ease of use, of course, 1-piece protease is very easy to use, because your penis is always hard. It can make a maximum angle of 15 to 20 degrees. When you are going to have intercourse, you correct that angle and go to the intercourse, and when you are done, it is already hard. 2-piece and 3-piece prostheses require a little more dexterity. So what I just described is that he's going to find the pump, he's going to find that button, he's going to get it down, and so on. It is a 1-piece prosthesis in terms of ease of use. Suitability. There is only one prosthesis that is suitable for all patients. 1-piece prosthesis. In 2-piece and 3-piece prostheses, we select some patients. Reason? For example, if the patient has a Penile plaque, then it may not always be appropriate to wear a 2- and 3-piece 1-piece prosthesis, or if there are serious curvatures, this can be corrected and done, but the most suitable 1-piece prosthesis is the most suitable in terms of suitability. We have to choose the appropriate patient for the whole disease and the patient for the other. The 1-piece prosthesis takes up to an hour for the patient to enter and exit the operating room. I don't know because I don't do it in 2 parts, but it probably takes an hour and a half or something. In other words, this time is about 2 hours in multi-part prosthesis. When can we use it? In all prostheses, no matter which one is attached, prostheses are used after an average of 8 to 12 weeks. For the sake of guarantee, I usually say 10 to 11 weeks. There is a training in 3-piece prostheses or there will be a training in 2-piece prostheses. At the end of this first month, we give a training. After downloading and uninstalling, the person is doing it on their own. After that, he can have intercourse. There is no need for training in 1-piece prosthetics. If you ask in terms of social comfort, of course, 2-piece and 3-piece prostheses are much superior to 1-piece prostheses in terms of social comfort. This is very important, actually. Why is it important? In other words, it may not be important for everyone, but think about it, it will be a bit of a problem for a 40-year-old married person at work, someone who is in social life, to have a hard penis all the time, to walk around hard, because he is in his social life. For example, swimsuits are not worn with a 1-piece prosthesis. That is, it is obvious if a swimsuit is worn. We apply it with a 3-piece prosthesis or a 2-piece prosthesis if there are suitable ones, taking into account both social comfort and social comfort, especially in young patients, who have many years ahead of them and are suitable. The risk of infection is almost the same in all of them. Between 1 and 3%. The risk of infection has also decreased slightly. Why? Here the operating room conditions have passed, our antibiotics are good, we are paying attention. And many of their prostheses are now covered with antibiotics, so prosthetic technology is also improving. Therefore, the risk of infection is reduced. As we say 96 to 99%, the failure rate of 1 to 3% here is due to infection, especially those with uncontrolled diabetes, which should not be operated, but sometimes you have to do it. It can't be controlled, of course, we take the risk. Or in those with tissue healing, such as excessive smoking or substance use, of course, the risk of infection is different because tissue healing is difficult. Now here I have made a price and performance. What does that mean? In other words, there is a prosthesis and there is happiness. I'm talking about sexual bliss. In social happiness, the opposite will happen. I'm talking about sexual bliss. What is the simplest prosthesis? 1 piece. What's the cheapest? 1 piece. Is there a difference in sexual satisfaction from others? There is no difference. What is it then? The prosthesis with the highest price performance is the 1-piece prosthesis. Price performance, which is the lowest prosthesis, then 3-piece transverse longitudinal prosthesis. Of course, if this is considered in terms of sexual satisfaction, social comfort, social convenience, and ease of life, then this is reversed. That's all I have to say about prosthetics in general. I hope I was able to be useful. Thank you.